Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Atomoxetine. Its brand name is Strattera. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on this video as it would really help me out with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to start by talking about how atomoxetine or Strattera works. We're going to discuss indications or reasons we would prescribe this medication to a patient, then contraindications or reasons we would not be able to prescribe Strattera, followed by examples of dosing, and then stick around to the end because that's when we'll talk about side effects with percentages. So how does atomoxetine work? So it's a selective norepinephrine reuptake inhibitor. It potentiates the effects of norepinephrine. In terms of indications, we would generally see this medication prescribed to treat attention deficit hyperactivity disorder, or ADHD. Now for contraindications, or reasons we would not be able to prescribe this medication, the first one would be if a patient had a hypersensitivity or allergy to atomoxetine, or really any other component of the formulation. If a patient had narrow angle glaucoma, they would not be able to use this medication. And as well, it would be contraindicated in patients who have severe cardiac or vascular disorders that would have a risk of worsening from an increase in blood pressure. Finally, this medication would not be able to be used by patients who have used a monoamine oxidase inhibitor in the previous 14 days. Now for an example of dosing with this medication. So if it's being used, like usual, to treat ADHD, then the initial dose would typically be 40 milligrams given orally daily. They may increase the dose after 3 days to 80 milligrams daily, and this may be taken as a single dose in the morning or as 2 divided doses throughout the day. There's an option to increase the dose yet again to 100 milligrams per day after 2 to 4 weeks of therapy. The maximum dose for this medication would be 100 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using atomoxetine, so I'll go over some of those here now. About 8% of patients may experience dizziness, while 19% may experience a headache. Insomnia comes in at a rate of 15%, and somnolence comes in at 8%. 10% of patients may experience an increased heart rate, and about 2% may experience weight loss. Abdominal pain may happen 7% of the time, and constipation may happen 8% of the time. A decrease in appetite may occur in 16% of patients, and up to 26% of patients may experience nausea. Vomiting may happen in 4% of patients. Xerostomia, or dry mouth, may happen 20% of the time, and about 8% of patients may experience erectile dysfunction. 10% may experience fatigue, and 6% may experience a delay when they begin to urinate. The more serious but rare side effects would be aggressiveness, mania, or suicidal thoughts. That's all we're going to talk about today with atomoxetine or Strattera. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable, remember you can support the channel by liking the video or by subscribing to the YouTube channel. There's also some links in the description you can check out as well. But for today, take care.